Okay, there's another few more people. Alrighty. Okay, so welcome everyone. My name is Latrice Preston. I am the strategic business partner for iCuba. I thank you so much for joining us today. I'd like to welcome today Carlos Antonell with Sanitas, and he is going to be presenting information today to you all with regard to all of the wonderful benefits that you can take advantage of by using the Sanitas facilities. So I am going to turn it over to him while I grab the presentation, and I will let you go ahead and with your introduction, Carlos.
Awesome. Thank you, Latrice and iCuba for inviting us. We're honored to be here and speaking to all the members that have joined. My name is Carles Antonell. I'm based in St. Pete. I've been with Sanitas for about 3 years now, but I know the organization for a long time. Something that we're going to cover, but I'm from Spain and I was born in a Sanitas hospital. So familiar with the brand for a long time, very proud to represent. I hopefully, today I can deliver a presentation that can walk you through and help you understand a little bit about, what we do, who we are, and how we believe we have some solutions for you and your families when seeking care at the primary care level or in some areas urgent care, emergency care level as well. So yeah, let's get started here, Latrice. Thank you for pulling the presentation. Most important, and I'll repeat that at the very end. I want everybody to know that we can provide 4 very important things when we shop around for anything, right? In this case, we're referring to healthcare. The most important thing is access, right? How quick can I access that service? Well, at Sanitas Medical Center, since we're exclusive for Florida Blue Cross Blue Shield of Florida, we have access to our centers within a week. At some of our centers, we can even guarantee same to next day appointment. At our busiest centers, we're going to get in with you and your family within a week. Why we do that? We want to avoid you to go to any urgent care, OER, and do an unnecessary visit that can be handled at the primary care level. Convenience. How convenient is going to be, or how convenient is going to be, the access to Sanitas services. We have a model that everything is under the same roof. We're going to cover this here in a minute, but as you can see, at Sanitas, we're advanced primary care, and we have everything under the same roof for the convenience of the member. I'll cover what that means, but basically, it's right, the primary care, diagnostic imaging, lab work, and some care programs. Also, the cost and savings, right? Who not like saving money? Probably nobody. Why am I saying that? Because at Sanitas, and thank you to iCuba, we are at $0 copayment. So if you don't have a primary care, you're not happy with your primary care, or you want to have some savings, you come to Sanitas and it's going to be $0 copayment, not just for your annual wellness, but for any visit at the primary care level. And quality, you always want to make sure that the quality at the vendor, right, establishment, whatever industry you are, that you're going to get some of the best quality up there. We have a NPS of 81%. It means that 81% of our patients recommend Sanitas to their family and friends. The average in Florida is 57. So you can guarantee that you and your family members, your loved ones, are going to be in good hands at Sanitas. So let's remember access, convenience of care, savings, and quality. That takes us to our next slide. Oh, Latrice, are you able to go to the next one? Hey, Latrice, I'm still seeing the cover page, cover slide. There you go. If you can go one back, perfect. So what I was saying, right? What makes us different, guys? You're gonna feel very welcome. It's a very welcoming facility at Sanitas, and most important, we have a value-based primary care model. What that means that we're compensated for outcomes of health. I'm sure you got all seen it. You go to medical facility, you just feel like you're a number. That's because those doctors, those physicians, those healthcare groups out there, they have a volume-based model. They got to see a lot of people to be able to keep their lights on, to make any money. At Sanitas is the opposite. This is value-based primary care. We don't have to see many people. Our physicians are seeing 12, 17, 20 at their busiest day. So they get to spend a lot of time with you, and they're going to look at your physical, emotional, and social needs. We put you in the middle. We have a whole person approach to care. Important, we network with Flora Blue, right? There's not going to be any surprise billing with us. It's always going to be $0 copayment at Sanitas, and there's going to be a seamless coordination for the specialists. Why? Because we only refer to Blue. We only Blue, so that's the only network that we know. So we're going to send you a high performance specialist where that specialist has the same values that we have, and it's aligned with our demographics. Once you establish your care with us, if you think, hey, I want Sanitas to be my family doctor, then we can have access to all your medical records. Flora Blue will transfer everything, will give us access to it, so we can put you on the appropriate care and cadence. You can come as often as you want to Sanitas facilities. You'll see we have expanded a lot thanks to the great partnership with Flora Blue. We'll cover that, but we're starting with 3 centers in Miami, and now we have over 70 facilities in the state of Florida. But let's say that you don't want to drive, right? You hate being in traffic, spending gas. You can talk to one of our physicians through our virtual medical center. The app, it's called My Sanitas app. It's a 24/7 virtual primary care. They can see you for your annual wellness exam through a scheduled virtual visit, or they can also just care on demand. It's Saturday night, I'm not feeling well. It's Sunday night, my kid has fever, and I need a prescription, prescription medicine. Then connect with our app. It's a $0 copayment, and they'll send the medication that it's needed to your closest pharmacy. We have a comprehensive population health management. What that means is that when you establish the care with us, we have access to your records, and we're going to put you in a risk stratification, and we're going to invite you, we're going to encourage you and your family members to come, as often as the physician thinks that you should, just so we can get any chronic disease under control and give you the perfect care, but necessary, never over-prescribing care at Sanitas Medical Center. Trish, if you want to move to the next one. As I mentioned, we arrived here in the US in 2015. Sanitas is in 9 other countries, and we have 10 million patients worldwide. So it's a pretty large healthcare group. No matter where we are, we always deliver our comprehensive value-based primary care model, which is based on identification, prevention, and management of chronic care diseases. And that's exactly what we did in 2015 when we came to the US in a joint venture with Blue Cross Blue Shield in the state of Florida. We opened 3 centers, and we had 7,500 members. And now, 10 years after, thanks to this great partnership and the alignment that we had with Blue Cross Blue Shield, right, to just improve the health of our patients, of the communities that we serve, we have 70 centers and over half million patients in the state of Florida. So tremendous success, again, because we're very aligned with the healthcare with the healthcare insurance and the employers and communities that we work with. As you can see, we're in 3 states currently, 70 primary care centers. We have some mental health centers in Puerto Rico, that's 14, 1 hospital in Miami, that's the old Westchester Hospital, now rebranded Carrollty. And we have 1.4 million, patients in the United States. Our value-based model, as you can see, the little butterfly, that's a patient. We put the patient in the middle. We're patient-oriented. We look at you, not just at your, physical needs, but your social needs, your community needs. And if there is anything that you or family member could benefit from, we find that asset, we find that organization in the community, we create a partnership, and we help you with your overall health, not just physically and mental, but anything that might be social, might be, community wise, we find that help too. Latrice, you can go to the next one. So as you guys can see here, right, we have a lot of facilities. I think we have 28 facilities in the Miami-Dade, Broward, and Palm Beach. Then we expand to the Tampa area and Orlando. We're, in Tampa, we're in Hillsborough County, we're in Pinellas County. We have 3 facilities there. We're in Pasco, then Central Florida, 15 facilities. And, very exciting, last year, we like the beginning of this year, we opened 10 new facilities. We opened 2 new facilities in Jacksonville, Duval County, that, adding to the one existing. That means that now we have 3. 2 in Ocala as well, in the Marion County. We have 2 brand new facilities with availability the same day. And we opened 6 new Sanitas medical centers in Southwest Florida, 2 being in Naples, 1 in Cape Coral, Fort Myers, North Port, and Venice as well. And 2 years ago, we landed in Tallahassee. So we have 4 new facilities in Tallahassee. You guys have access to any of these facilities, right? You might establish your care in Miami-Dade, but maybe you're traveling to Naples for the weekend and you don't feel well. You can have access to our Sanitas in Naples, even though you're not going to be talking to the same physician, obviously, but you're going to find another great doctor, and they can prescribe you medicine. You can have a consultation with them at a $0 copayment. As you can see, there's 2 different colors, right? We have green and we have blue. Our green facilities are our largest facilities. On those facilities, you have more doctors, but what really is different, it's the diagnostic imaging and the urgent care services. In the Miami area, on the green dots, you have ultrasound, X-ray, and EKG, all at $0 copayment, but also you're going to have urgent care. The Miami area, right? 4 facilities with urgent care and diagnostic imaging. That's going to be at $0 for the diagnostic imaging, and for the urgent care, it's only going to be $30, 30, twice $30 for IQVIA members for Sanitas urgent cares. In Central Florida and Tampa, you can see that there are 5 green dots. Those green dots are going to have diagnostic imaging as well, but will not have urgent care. In Central and West, most of you guys know, we have Guywell Emergency Doctor, which has an urgent care copayment, which with IQ, it's $30, and they can provide you with emergency care. Now let's move to the next one and talk about the scope of services. Most important, right? We talk about cost and savings in the beginning of the call. $0 copayment, guys. You go to primary care, you don't have a cost. It's very important that at least once a year, everybody sees the doctor, they talk to them, they share anything that's concerning, and they do the blood work. That's what we focus. We focus on identification and prevention of chronic care diseases that could be really serious if they're caught in a advanced stage. That's what we want you to do. Come to us, pay $0 copayment, and do everything under the same roof. You come to us, you're going to talk to our primary care doctors. You're going to see family medicine, internal medicine. We do have some pediatrics. Maybe you meet with one of our great nurse practitioner or PAs. They can do exactly the same thing as one of our MDs. In that center, if it's one of the green dots that we've seen, one of our hubs, our larger facility, you're going to be able to do advanced urgent care same day. If the physician recommends you to do an X-ray and you're in one of our large facilities, we have diagnostic imaging. Remember, at all of our facilities, we can do EKG, and only at the hub locations, the larger locations, we're going to have X-ray and ultrasound. You can do it the same day on the same encounter for $0 copayment. At some of our facilities currently, out of the 70, 17 have medication dispensary. So for your convenient, for you to save time, we're gonna have 200 prepackaged medicine at some of our facilities. In this case, right now it's 17, where you're gonna walk away from Sanitas and you can walk away with your medicine on your pocket. Everything on the same roof, at no cost, with access in some of our regions, same to next day, but at the busiest ones, within 7 days. Care programs, very important. What else can I do at Sanitas? As I mentioned, we have a whole person approach to care. We understand that there are other factors that can affect your overall health, and we don't want you to have to commute to another facility, deal with more paperwork. That's why we have three great care programs here at Sanitas. The first one is going to be your Be Well or behavioral health program. We understand that there is no health without mental health. So we're going to have licensed therapy. We have counselors at all of our facilities. At the ones that we don't, you can do it via our great app, My Sanitas app, and they can treat anything that is mild anxiety, mild stress, and depression. You meet with your physician, you do your x-ray, you do your lab work, and they say, hey, if you have a little bit of more time, we would love for you to meet with our counselor. I think you could benefit from talking to somebody about that problem that is causing you depression or is causing you stress. We have it in-house, guys, at $0 copayment too for IQVIA members. Something else that could affect your overall health is your diet, is your lifestyle. That's why we have nutritionists. We have a nutrition management program. We have dietitians in-house. If they're not in-house, you can schedule through the app as well. So if the doctor thinks that you could benefit from talking to a dietitian, a nutritionist, that could, your healthy habits can improve your overall health, then we're going to enroll you on that nutrition program, and you're able to take care of that too at Sanitas for a $0 copayment, thanks to the IQVIA benefits. And then another care program that is fantastic for those ones that might have a chronic care disease, such as asthma, diabetes, high blood pressure, COPD, hypertension. If the doctor thinks that you could benefit from meeting and enrolling in our chronic care program, you're going to be meeting with a nurse on one-on-one basis, at least every quarter, to talk about anything that might be affecting you and anything that could help you reducing the medicine or, kind of lowering the symptoms for the chronic care disease that you might have at that moment. Those 3 care programs, they're at Sanitas. They're at $0 cost for IQVIA members, and you can do them the same day within the same encounter that you come to Sanitas for anything else. Next slide. We do all these online, right? As well. It's My Sanitas app. It's a fantastic app. It's a super user-friendly app that we want you to download. I wanted you to have it ready, right? Because we don't want you to have to deal with passwords, usernames, when you're not feeling well and it's Saturday night and your kid, fever down doesn't go down after medication. Please do it that. Register with your Florida Blue ID and have it ready for that day that you don't feel the best or family member doesn't feel the best. Our teams are available 24/7, 365. Guys, I think that's really important. There's some other vendors out there like Teladoc, great vendor, but they don't have their own stuff, right? It's all 1099 providers that they're based who knows where in the States, and they don't know anything about you. They don't know maybe even the carrier. When you use our app, that app is staffed with our own providers. Our virtual medical center, it's in Miami, and it's staffed with 48 physicians. When those physicians pick up the call, or the phone call, the video call, or they're getting your text messaging, they know that you're a Blue Cross Blue Shield member, and they understand that we have a relationship with it, so that you're gonna get the best care, the most care treat that you can get through a virtual application. Important too, if you're a Sanitas established patient already, or you're gonna become one this year, it's great because our physicians on the virtual medical center, they have access to your medical records, so they can see that you were at the doctor a few days ago. They can review your blood work, and they can change any medication that was prescribed with you if they think it's going to help you improve. Important too, it's going to be at $0 copayment, just like if you come in person. If you never want to go to a Sanitas facility, you can do everything online. You can schedule your annual wellness. You're going to meet one-on-one with a physician, right? Just like we're talking right now through the computers, and they're going to send your lab Quest. You can just go to Quest or Sanitas and do your blood work. You never have to, step into a Sanitas facility to even establish your care or do you the first visit. You can do absolutely everything through the app. Also, what's really important for those ones that have our loved ones, far away, maybe in another country, maybe another state or another city in Florida, you can have the physician send a text message or an email to your family members so they can join the call as well. So it can be a three-way call. You have a family member there to support you, ask you good questions if you're not in the right mind because you feel stressed or anxious after a diagnosis. They can be with you during that virtual visit as well. Next one. This is important too, and I know iCuba have shared with you. I would love for you guys to, of course, become a Sanitas patient. I know you will get the best care and talk to the most caring physicians out there. And this is the thing that can help you scheduling your appointment. Okay, I think it's very, very important that you know that you have someone local in your market that is going to treat you like VIP, white glove, concierge type of services. I want to avoid you guys to call our call center, right? The 800 number. I hate calling 800 numbers. I mean, they're necessary, right? But if I would know that I have someone local in my county that I can text or I can call, I would do that, right? You can, as you guys can see, we have 1, 2, 3, 4, 5, 6, 7, 8 membership ambassadors. 3 based in the Miami area, and the other ones, Liliana covers Southwest Florida, Clarice in Tampa, Pedro's in Central Florida. I will make sure you have their contact information, and when you want an appointment, when you need help with, anything that is in the app that is not working, you can relate to your local membership ambassador. Their job is to set appointments, so please call them, text them. They're going to be happy that you call them or text them, and they're going to help you. Scheduling that is going to be much easier than going through the call center. And of course, you can always email me as well if that's not working. I'm sure Latrice will share my information, and I could talk to the team. On the next one, that one really quick. That's some of the engagement that we do. We go to a lot of the schools. So if you ever see Sanitas tablecloth at the break room during open enrollment, during the wellness fair, please go introduce yourself. That's going to be me and the membership ambassador or the membership ambassador if I'm not available, and they're going to be able to schedule an appointment on the spot for you. That's even easier than calling and calling or texting them. On the next one, you guys can see flyers. We're working on a customized flyer for iCuba. I didn't have it ready, so I couldn't put it here. But soon, you guys are going to be able to see some flyers with Sanitas that has the membership ambassador name, the membership ambassador email, and we're going to be able to text and call through that, right? So if you ever see one of those posters on your newsletter, on the intranet, on your portal, anyway, any ways of communication you guys have, you're gonna be able to see there the phone number and the email of the membership ambassador in your area that can help you coordinating anything from an appointment to a referral to a follow-up. They're there for you to work. The next picture, so one of our setups. If you guys see any of this tablecloth, that you see me or my membership ambassadors, please stop by, grab some of our, some of our marketing materials, some of our giveaways and marketing swap. Please introduce yourself, or we can help you scheduling a visit in person or virtual, or to any of our care programs. I believe that's the last slide. Yeah, thank you so much. Just to recap, the same four things I say in the beginning. Access, right? At our 70 facilities, you have access for a $0 copayment. And you have access the same to next day at most of them. So we provide you with cost savings, convenience, everything under the same roof, from PCP, annual wellness, to nutritionist, chronic care, and dietitian. And I can guarantee you're gonna have the highest quality PCP, since we're at 81% of NPS, which is way above our peers in the industry. Thank you, everyone.
All righty, thank you so much. Is there anyone here who is in attendance who actually has a question for Carlos, or anything that he did not cover that you are curious about? This would be an excellent opportunity to get it directly from him, so feel free to ask. I don't see anything in the chat at this time.
The chat is disabled.
Ah, that's probably why.
I have a question. I don't mind saying it out loud. So I'm in the Central Florida area in Orlando. I see that there are a couple of Sanitas here, and one in Longwood and in Orlando. What hospital was Sanitas be affiliated to?
Yeah, great question. So we are not affiliated with any hospital, right? Of course, in the Central Florida area, we have great relationship with Orlando Health and Advent Health. So it's going to be up to the physician, and of course, at the end, you have the right to pick where you want to go. That's going to be up to the patient. Yeah, but we're not tied. We're not tied to any hospital group. We want to keep you out of there.
Okay, but let's say, just an example, if you're having a procedure that needs a hospital, then it would be up to the physician, your primary care physician, to recommend you to one of those two,
Yeah.
either Advent Health or Orlando Health.
Yeah.
Okay. All right. Thank you. That was all.
Yeah.
Thank you.
Thank you.
Is there anyone else that has any questions that they'd like to ask at this time?
Yes, I have a question and a comment.
Sure.
So piggyback on the question about the hospital, if you have an emergency, Advent Health is not nearby us in South Florida, nor is Orlando. So what would be our options? That's the question. And then I wanted to just share my experience 2 years ago was horrendous with Sanitas. The medical assistant did not speak any English, could not communicate with the pharmacy. And I mean, it was just not a good experience. When trying to reach the doctor, you get the 1-800 number. The doctor didn't respond. The doctor didn't know what was going on. And it was just very hard to reach the medical office. And then when you reach the medical office, if anybody else wanted to speak to them, it was just horrible.
Yeah.
Am I clear that this was, you said you did mention this was 2 years ago, Ms. Gamble?
Yeah, I actually brought that up to Carla, so she had already brought that concern. Jeanette, this is not the form right now for that, because I had already taken that up to the next level for you.
Well, I never heard back from them, so I apologize if this was not the right, but I just want to know if there any improvements have been made, or what's going on.
No,
I
totally.
believe that's why, let me intercede for a moment, Carlos, and then I'll let you go. But I believe that's why I asked, if I was clarifying if it was 2 years ago, because I am positive that absolutely, because what we do as the IQBA team is we try to evaluate all of the questions and concerns that you have, and then we directly connect to all of our brand partners in an effort to remedy any issues that you may be dealing with. So I will be happy to, along with Roninia, to continue to look into your particular circumstance from those couple of years ago. And we'll be happy to assist in that way. But I can assure you that at this point in time, we have had relatively little noise with regard to Sanitas.
You
But
know,
we
I mean,
appreciate your input. Like we always want to make sure that we have the entire picture. So we do thank you for your input.
yeah, no, totally. And trust me, we're not perfect, right? We aim to be perfect. We aim to provide the best care, but we know that sometimes we fail, right? We're not going to point fingers who's responsible. But I can tell you, 2 years ago, 2 years and a half ago, when I joined Sanitas about 3 years ago, our NPS was at 62. Now it's at 87 across the state. So much higher. So I want to say I'm confident that we're doing the things better. Also for employer groups, members, that they get their benefits through their employer. We came up with this new position. I encourage you, Ms. Gamble, that you get to know your membership ambassador. That's going to be the easiest way to go. If you want to avoid the route of going to the call center, since you didn't get good experience there, and the membership ambassadors are fantastic and can help you and get to all these little things or big things very quick too. So yeah, hopefully next time you call me, if you give us one more chance, we're going to provide you the best care out there. And I think you had another at the beginning of your question. I think I missed it. Did you say something about that you're far from Orlando?
Yeah, South Florida, we don't have Advent Health, or we're not near Orlando Health either.
Yeah, so again, we know what hospitals where specialists are in network with Florida Blue, and based on how Florida Blue rate those hospitals and specialists, we're gonna try to send you, to the top performing hospitals and specialists in your area. That's how it works. But we're not affiliated to anyone.
Thank you, Carlos.
Yeah.
Are there any additional questions at this time? All righty. I'll take that as a no. So once again, thank you so much, Carlos, for taking the time. Thank you everyone for taking the time to join. With regard to wellness credits that you do receive for attending this webinar, all attendees will be forwarded automatically to Personify in order to get your credit. And we thank you for joining. We hope you have a fantastic afternoon.
Thank you.
Thank you. Have a good
Thank
day.
you.
Thank you. Have a great
Thank
day.
you.
Thank
Thank
you.
you.
So much.
Thank you. Have a great day.
Thank you.
Thank you.
You're so welcome. Thank you.